Introduction to Nursing Concepts, Medical Terminology, Elimination Unit. This is Martha Olson. Hema is blood. When we have blood in the urine, it's called hematuria. When we have blood in the emesis, it's hematemesis. So anytime you see hema on the beginning of a word, it means blood. Hematocrit is looking at the red and other blood cells within the body. Hematology is the study of the red blood cells. ITIS is an inflammation or infection. For this elimination unit, a cystitis is an infection of the bladder. Stomatitis is an inflammation or infection within the mouth. Glossitis, that's your tongue. That's an infection of the tongue, and we're seeing more of that with some of the piercings that people are choosing to have done today. Diverticulitis is the picture that you see on the slide. And diverticulitis can be especially problematic if they open up and the person then gets a peritonitis or an infection in that peritoneal cavity. Bacterio is bacterium, and when we have bacteremia, emia, the end of that word is blood, so it's a septic infection or a bacteria that has gotten into the blood system, which is a very serious condition. Bacteria is urine that has bacteria in it, and again, that would be a serious condition. Urea is urine, so if we have anuria, anuria is without any urine at all. If we have glycosuria, it's sugar in the urine. Hematuria, like we said, is blood in the urine, and dysuria is an abnormal urine. Dys is abnormal, so for some reason it's either an abnormal color or something is abnormal or not correct about that urine. When we have the word or the suffix scope on the end, it means to examine. So when somebody goes in for a colonoscopy, it is scoping that colon to check for diverticuli, for polyps to remove because they're precancerous. Colonoscopies usually start at age 50 for just routine health screening. Frequency and urgency are terms you might see used in this elimination unit. Frequency means having to go often. It can either refer to urine or bowel elimination, and then urgency is needing to go immediately. And to get there very quickly because you feel the urge to go. With male anatomy, we have foreskin. We have males that are circumcised or uncircumcised, and with the male that's uncircumcised, you will see where the retraction of the foreskin will be something that we talk about in the hygiene unit as well as the elimination unit because it can affect male urine elimination. Peri is around, so when we have perineum or perineal cares, it's around that perineum area. Peristalsis is the movement of the bowel, and it's all around that bowel, so it's the muscle, both longitudinal and circular, that are causing that fecal matter to move through the GI, colon, and small intestine tract. When we have position, we have perpendicular and parallel. And so we will be looking at perpendicular is up and down, and parallel is side to side. Another position for this medical terminology in the elimination unit is looking at how we would position a patient to either put the Foley catheter in, to give them an enema. We need them in certain positions. Prone is where a person is laying on their stomach. Orthopnea is the gentleman sitting up, leaning over the pillows. That was talked about in the oxygenation unit because it helps a person to breathe easier. The Sims position, as you can see, the person's getting an enema. And then high Fowler's is where a person would be sitting almost upright, very high in the bed for some reason to probably allow easier breathing, or that's how you would sit to eat a meal. If something is noxious, it's physically harmful. I usually think of smells that are noxious, men that are out applying chemicals and anhydrous ammonia. Those are very noxious and very toxic, poisonous things that somebody could breathe. A stoma is an opening, and at the end of a word, when you have a suffix, a stomy is to open. And so like a nephrostomy opens up into the kidneys, and it drains the urine from the kidney, either because they've had bladder cancer and they had to remove the bladder, or for some other reason a catheter is put into the kidney to drain it, and then it goes into a bag, and that would be called a nephrostomy. Urosepsis. Uro is urine, sepsis is an overall infection. As you can see from the diagram, they usually start as a urinary tract infection. They ascend up the ureters to the kidney. The kidney's very vascular. From the kidney, then the body becomes septic, or they have like a septic shock going on. So it's very important that UTIs are caught early so that we don't cause an infection that is very hard to treat and can be deadly as well. So to summarize some of the things that we've talked about in this elimination medical terminology review, elimination can be either urine or feces. They come from two different body systems. Waste products tell us about the health of the body. If you have hematuria, blood in the urine, that's an unhealthy finding. And so when we look at waste products, it can help us to know what's going on inside the body. Waste not properly removed can be toxic to the body, like a urosepsis or a peritonitis where the diverticuli breaks open. And when urine and feces cannot be removed normally, we create an opening or a stoma to remove them. I hope this was helpful in your review for the test. Thanks.